College is an exciting time. The world is open wide, and you get to really think about what you want to do with the rest of your life. Many people choose business, art, philosophy, even archaeology. I will give you some insight on a practical but often overlooked career that will give you stability and variety in your career. Nursing is an in-demand career. It offers flexibility, it's upwardly mobile, and it's high-paying. What if I told you that this career is recession-proof? It's high-paying and it's transportable, meaning you can transport your license to any of the 50 states in the United States. I'm going to tell you about a career that offers competitive pay, it's upwardly mobile, and it's dynamic. Nursing offers competitive pay. Nurses get paid well. What used to be considered a low-paying job several years ago is actually now quite lucrative. Please look at this picture from the U.S. Bureau of Labor Statistics showing average RN salaries in the United States. Salaries vary wildly. So in Kansas, the average RN salary is $64,000 a year, while in California, the average RN salary is $113,000 a year. While that is a big difference in salary, you have to remember that the cost of living in California is much, much higher than it is in Kansas. So a house in California probably costs double what it costs in Kansas. Many nurses work more than one job. So many nurses will work 3 12-hour shifts in the hospital and they'll work a per diem job on their day off. So a per diem job really just means that you're getting paid for the day. So an average per diem job is home health and hospice. And people use that extra income for childcare, for Christmas, or to go on vacation. I know several licensed vocational nurses here in California who actually make 6 figures by working a regular job and a per diem job on top of that. Now that we've learned about what nurses get paid, let's talk about the variety of roles in nursing. You can work a variety of specialties in your career while still staying in the same profession. According to Nancy Carlington, RN, the most rewarding thing I found about a career as a nurse is that you can change careers multiple times, so to speak, and yet still remain in the same profession. During my 16 years as a nurse, I worked in NICU, ER, case management, and I've even cross-trained in several additional areas within the hospital setting. I currently work in urgent care clinic, and I've been there for almost 4 years. If you're a nurse and get burned out in one area, or just want to change scenery, the sky's the limit. So that really is true. So, my first job in nursing was actually on a psychiatric unit. And I did that for 2 years. And I worked 12-hour overnights on a unit with 15 patients and 3 staff underneath me and no security guard. So actually that was quite dangerous, so I decided to go to a safer specialty, and I've been in hospice for the last 5 years. Many job roles require a nursing license, but those roles can be very different. You can work in the hospital, you can work in case management, or you can work as a nurse management in the office. So really, it just depends on what you want to do. You can take that nursing license and really do anything you want. I know nurses who actually work in the IT department and work on computers, but they're RNs. You do not necessarily need more schooling when changing specialties. You get trained on the job. So let's say that you're working labor and delivery and you get burned out on that and you go to the cancer department. So while delivering babies and chemotherapy are vastly different, you don't necessarily need more schooling. You just need to be trained on the job. Nursing is upwardly mobile. So now that we've talked about the variety and flexibility of nursing, let's talk about climbing the ladder as a nurse. So what exactly is climbing the ladder? Well, it's exactly as it sounds. So I have a visual right here, and it shows the different levels of nursing. So the first level is a certified nursing assistant, otherwise known as a CNA. And that's just a certificate, and typically that takes about 2 weeks to get. Next up is a licensed practical nurse or licensed vocational nurse, depending on where you live, and that is a diploma. So that typically takes between 15 months to 2 years. It just depends on where you live and how long your schooling is. And like I said, that's a diploma. And from there you can bridge to an RN. So there is literally bridge programs out there, and you take a 1-year program and you can get your registered nursing license. And that right there is an associate's degree. From there, you can bridge over to a BSN, and many BSN programs are available online, and they typically take 1 to 2 years. And after you get your BSN, you can go ahead and build upon that and get your master's. So that's called an MSN, Masters of Nursing. And then from there, you can do an advanced practice degree. So that's a nurse practitioner or a CRNA, which is called stands for a Certified Registered Nurse Anesthetist. And what a nurse anesthetist does is they work under the supervision of an anesthesiologist. So many times when somebody is in labor and they need an epidural, that's a nurse anesthetist. And that's actually the highest paying job role in the nursing profession. Here in California, nurse anesthetists, their starting salary is $180,000 a year, and that's just to start. Nurse practitioners, they can work in a clinic setting. So they'll work in an urgent care, and if you go in and you, let's say, have a sore throat and it's strep throat, they can write you a prescription for antibiotics, pain medications, but they do work under the supervision of an MD. And finally, you can get your doctorate. So you can be a doctor, I mean, not an MD, but a doctor of nursing. And that's how you climb the ladder with nursing. According to the National Council of Nursing, APNs are defined as a registered nurse who has acquired the expert knowledge base, complex decision-making skills, and clinical competencies for expanded practice, the characteristics of which are shaped by the context and or country she is credentialed in practice. Advanced practice nurses, such as nurse practitioners and CRNAs, work under the supervision of an MD. They are even allowed to write prescriptions. We've reviewed how nursing offers competitive pay, a variety of specialties you can work while still staying in the nursing profession, and how nursing is upwardly mobile by climbing the ladder. I encourage you all to think about what you want as a career. If you crave job security and a variety while enjoying helping others, please consider nursing as your career. In conclusion, nursing has become one of the most dynamic careers in the United States. While it does take good grades, dedication, and a whole lot of studying, all of the hard work pays off in the end. I personally know many nurses who make incredible salaries while doing something they love. At Kaiser Permanente, the company I work, our nurses are encouraged to maintain a work-life balance by taking plenty of time off for vacations and self-care. They have pensions and 401ks, and they get to take care of wonderful people for a living. It is best to start on the path as a nurse at a young age. But remember, it's never too late to become what you might have been. Nursing is also a very popular second career. I am proof of that. Thank you.